going to study about STNMP staging. So we have different staging systems for oral cancer. The STNMP staging is one among them. Being a PG student, I very well know that we need to study a huge number of classification systems, especially at the time of exam preparation. Don't worry, I am here to help you guys to easily remember and memorize one of the most important frequently asked question, that is nothing but STNMP staging. Basically, this STNMP staging looks at site of the primary tumor, size of the primary tumor, nodal involvement, metastasis and pathology. S stands for site of the primary tumor. T stands for tumor size. N stands for nodal involvement. M stands for metastasis. P stands for pathology. Site of the primary tumor is categorized from S1 to S9. How we are going to remember this? Now at this point we need to think about a word malignant. Basically we are studying about malignancy. So now we need to count that word malignant. Totally 9 letters are there. So we have 9 subdivisions in the site of the primary tumor. Now we need to look at this word site. Actually it is SI, but we need to write like S1. So totally we have 9 subdivisions in the site of the tumor from S1 to S9. So next is tumor size. Now we need to look at this word size. We need to count this word. So totally we have 4 letters. So this tumor size is categorized from T1 to T4. So like previous categorization where we had S1 to S9, here we have T1 to T4. So next is nodal involvement. Now please have a look at this word nodal. So in this particular word we have 5 letters. So we are going to write like N0 to N5. Actually it is NO, but we are writing like N0. So totally we have 6 categorizations in this particular nodal involvement category. Next is metastasis. So like previous one, here too we are going to write like M0. And in this particular word metastasis, we are only taking first 2 letters. That is ME, me. So we are writing like M0 to M2. Next is pathology. Like previous one, here too we are writing P0. Previously we have taken first 2 letters, but here we are taking first 3 letters. So we are going to write like P0 to P3. And this P3 is again divided into 3A, 3B, 3C and 3D. Now let's study each of the subcategory in detail. As I mentioned earlier, site of the primary tumor has 9 subdivisions. In order to study this particular category, we are going from outside of the oral cavity to inside of the oral cavity. I am very glad to attach my multi-talented best friend Dr. Reshmi's drawing with this. Before going into the oral cavity, outside we have lip as well as skin. So that is S1. S1 is nothing but involvement of the lip and outer skin surface. Next, adjacent to the lip we have labial mucosa. Okay, so that is S2. Involvement of labial mucosa is S2. Okay, so if you go further, you can see tongue there. So that is S3. Involvement of tongue is S3. On either side of the tongue, we have buccal mucosae. So that is S4. The roof of the oral cavity is formed by palate. So that is S5. And the floor of the oral cavity is formed by floor of the mouth. That is S6. S7 and S8 has A. S7 alveolar process. Involvement of alveolar process is S7. Involvement of antrum is S8. S9 has B. That is involvement of bone. So this is about involvement of site. This part is very easy. So if the tumor size is less than 2 cm, then it is T1. If the tumor size is between 2 to 4 centimeter in diameter, then it is T2. If it is between 4 to 6 centimeter in diameter, then it is T3. If it is more than 6 centimeter in diameter with involvement of adjacent structures, then it is T4. Next is nodal involvement. So this part is also very easy. It has got 6 subcategorizations starting from N0 to N5. 1, 2, 3, 4, 5, 6. Okay, so first is N0. We just remember like no, N0, no. So there is no clinically palpable lymph nodes in case of N0, nodal involvement. Next is N1. If there is any doubt, you can give N1 nodal involvement. If there is any doubtful situation or equivocal situation, you can give N1 nodal involvement. Next is N2. If there is a presence of clinically palpable lymph nodes on same side, that is homolateral, we can give it as N2 nodal involvement. Next is M3, that is homolateral clinically palpable lymph nodes which are fixed. So that is N3 nodal involvement. Next is N4, that is presence of bilateral or contralateral clinically palpable lymph nodes. In case of N5, there is presence of bilateral clinically palpable lymph nodes which has got fixed. So this is about nodal involvement. So next is metastasis. So in this particular category, we have M0, M1 and M2. M0 which is characterized by no distant metastasis, and in case of M1, there is clinical evidence of distant metastasis without any definite histopathological or radiographic confirmation. In case of M2, there is proven evidence of distant metastasis which is beyond the regional lymph nodes. Next is pathology. So this particular category has got 4 subdivisions, that is P0, P1, P2 and P3. P3 is again divided into P3A, P3B, P3C and P3D. P0 is characterized by hyperkeratotic lesion. P1 is characterized by carcinoma in situ. If there is basal cell carcinoma, then it is considered as P2. In case of P3A, there is verrucous carcinoma. P3B is characterized by well differentiated squamous cell carcinoma. P3C is characterized by moderately differentiated squamous cell carcinoma, and P3D is characterized by poorly differentiated squamous cell carcinoma. So this is all about STNMP staging.